Our session this afternoon is educating Black America about prostate cancer. Our theme is knowledge is the best defense against prostate cancer. This is a saying that we've coined, and it's one that we believe, and it's one that we're committed to, that knowledge is necessary to beat prostate cancer. If you think in terms of this disease, what we talked about this morning was when should you get a PSA test? Men need to understand that. What type of treatment? There are many options. Men need to understand their treatment options. And even when it comes to how do you best surviving prostate cancer, that's all about knowledge. So knowledge really is the best defense against prostate cancer. And I'm opening this session really with just a few statements, and then I'm going to turn it over to our panel. Educating Black America about prostate cancer is mandatory to eliminate the African American prostate cancer crisis. And I feel that we are making steady progress towards this goal. We're not there yet. We have a long ways to go, but we are making steady progress. And if you look at our strategy for outreaching and educating the community, it's through our church partnerships and through our survival network. This is really the foundation of our community education and outreach initiative. So you see here a map of where our focus is. We are focusing on the cities and those states with the largest Black population. And the only way that we can possibly reach these communities is through partnerships. And that's the reason our church partnerships are so critical. And we must have resources. And that's the reason our survivor network is so crucial. We saw Dr. Shelton, we saw other members of our survivor network today play integral roles in our programs. Well, they not only play integral roles in the program here, they play integral roles throughout the country. And we have a few hundred survivor network members, some more active than others. We would like to see all these members as active as Dr. Shelton and Dr. Kennard, but we're not at that point yet, but we're going to get there. And if you look at some of the accomplishments that we've had with these partnerships, I'll go back to 2003. That's the year that we founded FIN. As I said this morning, we're celebrating our 10-year anniversary. When we founded FIN, one of the things that became clear to me was that if we are going to have a national program, we must have resources across the country. So we immediately began our survivor network in 2003. We began our church partnerships with our Father's Day rally in 2009. That was 4 years ago. We did that in Massachusetts with just 30 churches participating. We sat down with a number of churches and said, hey, here are our plans, and we really need your support. And they agreed, they stepped up, and we did our first Father's Day rally with 30 churches in Massachusetts. We took the church partnership national with the Father's Day rally in 2010. And in 2012, we reached more than 250,000 people through the Father's Day rally. And really, that's over a 2-year period. So we had a number of churches that really understood what it was that we were trying to accomplish, agreed with that mission, and joined with us. Continuing on with the accomplishment, we approached 500 national church partners in 2013. So we have a church partner. If you look at all of those dots on that map, there's not a dot where we don't have church partners. So we're filling out the country, and we successfully piloted our education symposium in 7 cities with 7 churches in 2013 as well. And that's a new initiative that we'll speak about a little later. The Father's Day rally and symposium attracted national media coverage. And we reached more than 1 million people through the Father's Day rally and our national media coverage in 2013. So our theme here is joining hands in prayer and action to save lives. And we are succeeding with this mission. There was a time when we introduced this concept at the summit. Jerry Womack, who's not with us today, out of Massachusetts, I think in 2008, first spoke about our partnership strategy. And so we said this is something that we wanted to do. This was a goal. Today, I can stand before you and say that we are succeeding. This is a maturing process that has really become very effective. And I am more excited today about what I see as a potential of these partnerships. If we can make this progress since 2010, think about where we can be in 2016. This is 2013. Think about what we can accomplish in another 3 years, just using this format and this formula. So today, what we're going to do with these our panel discussion is to really look at some of the successes that we've had and some of the strategies that we are going to employ to strengthen and expand our activities in the community. One of the areas that we're looking at that we've introduced to our church partners is what we're terming church webcast fellowships. Finn broadcasts monthly education webcasts. We've been doing this since 2011. We began piloting this in 2011. And so now what we're doing is we're inviting our church partners to join with us with these monthly webcasts by hosting within their church webcast fellowship for their members to bring together prostate cancer survivors, newly diagnosed men, and their family members in a setting that is mutually supported. The webcast will significantly increase knowledge and support for those in need. What's happened for way too long is that members in churches and other venues will sit together, survivors, and not have any idea that the person sitting next to them is a prostate cancer survivor. And they may be looking at, well, I've been diagnosed and I'm looking for a certain type of treatment, and sit next to someone who may have experienced that treatment. And if they were to know that, they could gain some valuable information. And so we're going to bring, our goal is to bring these newly diagnosed men, these survivors, their family members, all together as we each month produce our webcasts. These are educational webcasts. We have a topic each month that really helps to expand and increase the knowledge. And so we're going to talk about this new initiative as part of our panel discussion. But this is an area where if we can do this successfully, now let me take that back. Once we do this successfully, we can now, I'm thinking in terms of reaching 1,000 or more survivors, newly diagnosed men, and educating them on a monthly basis, okay? We have enough church partners to do that. Once they engage with us, we will make that happen. And so our summit is to bring the strategies together and gain support. But this is the way we're reaching out, touching men and their families. It's through these partnerships that we have ongoing in the community. So that's my introduction to the session. This is where we want to go our next step. We have succeeded at every step that we have taken. And I feel comfortable that we will succeed with this next step with our church webcast fellowship. Now, we may call that something else as time goes along. If somebody comes up with a better idea of a name, we can look at that. But the formula and what we will accomplish, I've just outlined here. And so, ladies and gentlemen, that's where we're going with our next strategy. Now, at this time, I want to introduce a man that I spoke about before he got here. I talked about him behind his back. And now that he's here, I can say things in front of his face. But Congressman Gregory Meeks has been, as I mentioned before, just a staunch supporter of Finn's effort to eliminate the African American prostate cancer disparity. Congressman Meeks was with us and helped sponsor our first summit. We did it in the Raven House office building back in 2005. He accepted me and Finn as one of his own, and I have, I go into his office. I walked in yesterday. It was like a big homecoming. I didn't see you, Congressman Meeks, but I was welcomed probably by your team. And but Congressman Meeks has led the way. He's helped us with these summits. He's helped us lead the fight on the Hill when we need to reach out, as we have on this PSA test issue. We ask him for his leadership on the Hill, and he's always there and staunchly supported. And it's great to have friends, and it's great to have Congressman Gregory Meeks as one of our very best friends. So I introduce to you Congressman Gregory Meeks from Queens, New York.
Good afternoon. And let me welcome all of you to the 43rd CBCF Foundation Week. And they say weekend, but this is really a week. We do this all along, and it's been great. It's our annual legislative conference, and it's good to have you here. And I hope that you get a chance while you're here. It's good to have you here, and you get a chance to go to some of the other forums that we have going on during this week, today and tomorrow and Saturday, that maybe you get to go to the prayer breakfast or to the gala on Saturday night. Of course, some receptions and some other opportunities so that you can talk to others while you're here and let them know that you were here at Finn and about prostate cancer, and ask them. Sometimes in church, you always say, hit your neighbor and you ask them, have they been saved? Well, you do that. You ask them, have they been checked for prostate cancer? Let's just check them out. Let's make sure that they're conscious and they're focused on it. It seems to me, it's unbelievable. Tom, 9 years. 9 years since that we first started the African American Prostate Cancer Disparity Summit. 9 years ago, folks, I had no gray hair. And now, it's just about all gray. But 9 years ago, I can remember, Tom coming and talking to me, and at that time, Senator John Kerry on the Senate side, and we got together and we started talking about how we would move forward. Senator Kerry, of course, now is our Secretary of State, and I give him big kudos for what he's doing, especially putting together the U.S.-Russian framework so that we can get rid of chemical weapons out of Syria. And he's been a great diplomat and doing great work on behalf of the 44th President of the United States, Barack Obama. But back in 2005, I had an abundance of determination that was spurred on by that man, of course, to make a difference in Congress and through Congress for my constituents and our nation. But at that time, you had no seniority. Now, I've been in Congress 15 years. So now I have a little more juice, be more if we were in the majority, and I could be a chairman as opposed to ranking member, but I know y'all gonna help us make that difference come 2014. But now as a senior member on the House Financial Services Committee and a senior member on the Foreign Affairs Committee, and having a president like Barack Obama, I know that we can, we have, and we will continue to make a difference. And even though the debate that is going on in Washington, D.C., as we said, I'll be running out of here to make votes on something that doesn't make any sense. People trying to cut back on food stamps, and we've got this continuing resolution that's not going to happen, and so they're threatening to shut down the government, and we're going to be back here next week and with the same. But even though that we're not getting a lot of agreement here on budgetary issues, when it comes to dealing with prostate cancer and making sure that we have solutions and awareness, and especially to eliminate the disparity that African American men especially have, that is something that I think that we can come together with in Congress, because that's not a Democrat or Republican issue. It's not a North or a South or East or West issue. It's an issue that we should all be tackling, and we've been able to make sure that it becomes the awareness of members of Congress is there. In fact, you know, when I think about it, since 2005, there's 2 men in my office who had been diagnosed with prostate cancer since 2005. Both are now survivors, doing well, and they are part of the mission to get out and they talk to young men that come in our office all the time, trying to make sure that they're aware and that they are taken care of. And so we've got to make sure that we move forward. And because of those countless prostate cancer survivors across America, and because of individuals like in this room, and urologists and oncologists and surgeons and researchers and pharmaceutical firms, and because of countless black families and churches and fraternities and sororities and barbershops and beauty parlors and black radio stations and black newspaper reporters, we keep on keeping on. We're going to keep on spreading the message. I saw, you know, Mr. Farrington talking about a new way that he's going to reach 1,000 people moving off on websites. We're going to keep on keeping on. And so there's been remarkable progress being made in awareness, in treatment, and research concerning prostate cancer, particularly with reference to African American males. And millions of Americans within and beyond the African American community are now aware of the disparities African American men endure in terms of the occurrence, diagnosis, and treatment of prostate cancer. Congressional funding, which we are fighting for, and you know, this is all part, when you talk about the Affordable Care Act, preventive care, going in for regular checkups, making sure that it is there, is important. But congressional funding for prostate cancer in particular, for awareness and disparity research, has indeed increased since 2005. The summits have gone from just a couple of supporters in Congress to a broad bipartisan support. I was talking to some of my Republican colleagues when I was leaving a meeting coming here, and they knew and understood how important this was. The Congressional Black Caucus Foundation, in fact, makes it know that it's extremely important to incorporate the African American Prostate Cancer Disparity Summit into our regular agenda for our annual legislative conferences. And the Congressional Black Caucus members on committees with jurisdiction, led by Donna Christensen, who is the head of our health committee, works for healthcare funding consistently and leads the fight for increased funding for prostate cancer research, treatment, awareness, and programs targeted especially for black males. In fact, many Congressional Black Caucus members have hosted, as I have, events and awareness events and prostate cancer screenings in our districts. We do this on a continuing basis. We just did one in Brooklyn about 3 weeks ago. 3 years ago, the House Oversight and Government Reform Committee held hearings on prostate cancer, which drew attention to racial disparities. And last year, the Senate passed a resolution declaring prostate cancer within African American communities to be of epidemic proportions. The resolution also called for increasing the resources devoted to addressing racial disparity. There is still, though, a long ways to go to eliminate the prostate cancer racial disparity. But thanks to Finn and the annual summits that occurs here during the CBCF's yearly conferences, there's no question, as Mr. Farrington indicated, that progress is being made. But progress also, in all ways, produces additional challenges. And one of the new challenges is the confusion associated with early detection screening guidelines. When should African American men get started to be screened? Is it age 50? Is it age 40? Another source of confusion arises from the debate within the medical community about when the treatment of prostate cancer should begin. Given the disparity in regards to African American men, should treatment begin immediately? Should black men and their doctors follow a regime of active surveillance, as many medical experts now recommend? Should black men diagnosed with prostate cancer delay immediate treatment and instead have their doctor actively monitor the progression of the disease? These are questions that have happened with those individuals that I talked about in my office. They were going back and forth with questions that they had. I'm gratified that this year's summit is examining these questions. And given that black men in America have a 60% greater rate of prostate cancer and endure a 140% higher death rate than men in any other racial or ethnic group, what may be true or appropriate for the general American male population may or may not be applicable for African American males. We know recently, for example, just today, there was a report that prostate cancer is prevalent in those individuals who worked and saved lives during 9/11 down at the World Trade Center. And so it is now being covered under the agreement to treat those individuals who were injured and suffered illness as a result of that. But given the stakes, black men shouldn't be left to making decisions relying on just fella talk, guy talk, in the locker rooms or in the barbershops. Their decisions should be informed by expert opinions and scientific research. This caliber of information should be synthesized into a leaflet or a CD or into the websites that Mr. Farrington was talking about and made available in locker rooms, in barbershops, in churches, in community centers, in workplaces, on TV and radio and public service ads. In any venue where black men, their wives, their girlfriends, their partners, their children, their friends, their pastors, their professors, their co-workers, their golf buddies or their neighbors and their aunts, their uncles, everybody, wherever they are, we should make sure they have access to this information. I know that Tom Farrington has brought today a distinguished panel to talk about how we move forward, how we continue with the goal of keeping men alive so that they can be fathers, they can be husbands, they can be uncles, they can be neighbors, because it is the essential piece of a family, essential part of community to have males thriving. And so oftentimes we need our partners to tell us to go get checked up. So I'm delighted to be here for the 9th. I already look forward to the 10th and the 11th. We're gonna stay here, we're gonna keep doing it until we know that nobody dies unnecessarily because they were not checked for prostate cancer. That is the goal. The goal ultimately is, Tom, is to put the association out of business. And we're gonna keep working till you're out of business because we wanna make sure that everyone is aware. Enjoy and have a great week. Thank you.
You know, Congressman Meeks, when you put me out of business and I'm ready to retire, I know who should lead this organization. And I hope you can take on this job in addition to the one that you have, because you're right on target. And it's great, again, to have your support in this fight. And this is a fight to the finish. It's a fight to save lives. So again, thank you so much for those words today.